Hello, my name is John Blakeman. I'm a PhD student at Illinois State University and also an instructor in the School of Nursing at Millikan University. Uh, I'm the author of this manuscript, Prodromal Myocardial Infarction Fatigue, a Concept Analysis. And first of all, I just wanted to say thank you for watching this short video, and I hope to give you a little bit of a summary of my work and why I think it is really important. So some may ask, why conduct a concept analysis on prodromal MI fatigue? What's so important about that concept? And first, we know that heart disease is the leading cause of death worldwide, and men and women are affected as well. So this is not just a man's disease, though that has been somewhat of a myth over time. And also, specifically for women, we know that fatigue is the most common prodromal symptom or warning symptom that they experience in the days, weeks, and months leading up to a myocardial infarction or a heart attack, also abbreviated MI. So it's important that we understand, perhaps, the signs and symptoms that occur ahead of time before that actual event so that we can maybe do some things to prevent it. And I really wanted to develop an operational definition for use in future research. A good amount of research has been conducted about MI symptoms and prodromal MI symptoms, and even to some degree prodromal MI fatigue, but we really don't have a concept analysis for this symptom of prodromal MI fatigue, which appears to be very important. And my area of research is really symptom science and understanding MI symptoms, and especially women's experiences of fatigue before MI, and so I wanted to look at this concept a little more closely. So the aims of this concept analysis were really to examine the concept structure and function, which really comes directly from Walker and Avant's concept analysis strategy. So I looked at all of the different definitions and the ways that these concepts and the ideas within this concept have been used across the literature. And based on that kind of understanding of how this term has been used or this concept has been used, I wanted to clarify that concept and develop an operational definition that could be used in future research. And so just briefly, my real process for the analysis and kind of a definition development was to, of course, use Walker and Avant's approach. So I'm not going to go through each of those steps here, but that's certainly within the manuscript. Then I reviewed the individual definitions and uses, so looked at the idea of prodromal symptoms, looked at myocardial infarction, and then also fatigue. And then I took a look at the way that prodromal MI fatigue has been used as a concept, has been uncovered or discovered, however you want to look at that, as a concept across the literature. And I conducted comprehensive literature search, hand searches, and database searches, and that all is, of course, highlighted in the manuscript as well. Ultimately, what I developed was this operational definition, which is still, I would say, in process. Certainly, concepts evolve over time. And the idea that this is a lasting definition that will remain for posterity is probably not accurate. I hope that some of these items, these points within this definition can be honed and made more accurate. So essentially, it's an unpleasant symptom. It's subjective. It includes some combination of the terms weakness, tiredness, sleepiness, a lack of energy, cognitive change, fatigue. It occurs at least 24 hours prior to MI, and the problem here, to give any more definition than that, the term has been used so broadly from anywhere from a few days before to a year before that it's hard to really label yet a time frame. It's a notable change from baseline. It's unusual, not easily explained, and lessens in intensity after the MI, though it may not actually go away. And so the question may be, what now? Well, we know this is a very complex symptom. I mean, given that definition, what prodromal MI fatigue is to one person may be very different from another. So really exploring and measuring prodromal MI fatigue in a multidimensional way will be important. Understanding this is not a simple symptom, and it takes a lot of uncovering of what this symptom really is. And really we think this symptom can serve as a warning, and there's question about whether we may be able to include this in risk stratification for patients in the future if they're experiencing this symptom. So a question I would leave viewers or readers with is, what is fatigue to you, and how can we best study this symptom? Because it is incredibly complex, and everyone has their own definition of fatigue. I think that's an important idea. And moving forward, how do you think we can best study this symptom?